Gather your supplies: sterile gloves, hospital-proof disinfectant, 2 non-coring needles, a central line dressing kit, alcohol wipes, sterile normal saline syringes ×2, and 2 non-sterile saline syringes, needleless connectors depending on the number of lumens, sterile drape, and a mask for the patient. Clean your work surface with the hospital-approved disinfectant and allow to dry. Open your central line dressing kit. Don mask and place mask on patient. Perform your hand hygiene. And open and drop onto your sterile field your non-coring needle, your sterile saline syringes, your needleless connectors, and a sterile drape. Don your sterile glove. Flush through the non-coring needle sets and attach the needleless connectors to the non-coring needles. Return those to the sterile field when done. Remove the chlorhexidine swab sticks from their package and use those sticks in a repeated back and forth motion to the count of 10 for each stick, completely wetting the area to be cleaned. Allow to completely air dry. This may take up to 2 minutes. And note, if the patient is allergic to chlorhexidine, you need to use povidone iodine. Place the sterile drape below the port site to prevent contamination during accessing the port. Ensuring continued sterility of the procedure and non-coring needle set, insert the needle into the port using firm, even pressure. There should be an initial resistance as the needle enters the septum and another resistance as the needle touches the bottom of the port. Test for correct placement of the non-coring needle by aspirating and checking for blood return. If no blood return, reposition the needle and/or flush with at least 10 mL of saline and observe for infiltration. You can also have the patient hold their arms overhead, hold breath, and bear down, or turn patient on their side. If there's any question of correct placement, contact one of the resource persons. Once the correct placement has been established, flush with 10 milliliters of saline using the push-pause method and clamp the non-coring needle tubing on the final push. Disconnect the sterile saline syringe. Repeat the steps on the other lumen if it is a dual lumen port like we have here today. Remove the white wings from the top of the coring needle. Apply barrier film to the area where the border of the dressing will be applied. Allow to completely air dry. After completing the dressing, make sure that you add the date, time, and the initials on the dressing so it's legible and easy to see. Reapply barrier film on the top edges of the dressing border. Scrub the needleless connector vigorously for 10 seconds with isopropyl alcohol swab, allowing to dry for 10 seconds as well. Flush with an additional 10 cc non-sterile saline syringe.